A lesion in the spinal cord impacts far more than the ability to move the lower limbs. This diagram shows the autonomic nervous system. When this pathway is damaged, it disrupts the internal regulation of the bladder, the bowels, cardiovascular function, breathing, and sexual health. Clinical priorities change based on the specific level of the injury. For a patient with quadriplegia, regaining arm and hand function is often the primary goal. For those with paraplegia, the focus frequently shifts toward managing chronic pain or restoring sexual function. The moment this communication highway is severed, the body begins to degrade. Without constant regulatory signals from the brain, the lack of activity and altered nerve impulses immediately impact the health of every internal system. Recovery requires a multi-system approach to manually override and stabilize a compromised internal operating system. Without regulating signals from the brain, isolated muscles often enter a state of constant activity. They tighten and spasm, eventually physically shortening into rigid contractures. To manage this, therapists utilize established physical protocols, prolonged stretching, and serial casting. By applying semi-rigid casts to a tight joint and replacing them every 1 to 2 weeks, they can slowly restore a joint's range of motion. These interventions target the muscle spindles and Golgi tendon organs. A slow, sustained stretch triggers these internal sensors to inhibit the muscle's response, forcing the hyperactive tissue to relax and maintain its structural length. Vibration therapy offers another way to trigger this inhibition. When specific frequencies are applied directly to the muscle, the mechanical waves stimulate these receptors to send a calming signal, temporarily reducing spasticity. Successful management requires prioritizing this mechanical pliability over raw muscle strength to ensure the limbs remain functional for daily activity. Moving a paralyzed or severely weakened body requires overcoming the constant downward force of gravity. Therapists break mobility training into precise subtasks. A patient must master the mechanics of rolling and sitting upright without support before they can begin training for transfers or vertical lifts. Exercise also faces an internal hurdle. In cervical or high thoracic injuries, the body loses supraspinal sympathetic nervous control. Look at the difference in cardiovascular regulation. On the left, the brain and heart maintain a continuous signal loop to adjust to physical exertion. On the right, that loop is broken at the cervical spine, which severely limits the brain's ability to regulate heart rate and cardiac output during exercise. Mobility equipment is prescribed based on these specific physiological limitations. High cervical injuries may require power wheelchairs controlled by head arrays or breath-activated sip-and-puff systems, while thoracic injuries often allow for the use of manual wheelchairs. Overcoming the challenges of gravity involves re-engineering both external movement and the body's internal response to physical stress. Traumatized nerves at the site of the injury often create a permanent gap between intent and action, frequently accompanied by burning or shooting neuropathic pain. Robotics are used to bridge this gap. These systems provide the hyper-precise, repetitive movements needed for gait training that a human therapist cannot physically replicate with the same consistency. Functional electrical stimulation uses electrical pulses to bypass the spinal cord. Sending a signal directly into the muscle elicits a contraction. While FES creates movement, TENS focuses on pain. It excites sensory nerves to trigger the opioid system, effectively closing the body's pain gate. Pharmacological management provides further support through muscle relaxants and opioids. However, clinicians must carefully time these medications to ensure that side effects like lethargy do not interfere with the patient's active participation in therapy. Addressing the neurological gap requires a volatile balancing act between external electrical stimulation, robotic precision, and chemical symptom management. In a clinical setting, these diverse interventions are most effective when applied simultaneously. A patient might utilize medication to dull a neuropathic pain, while FES pads stimulate leg muscles as they are supported by a robotic treadmill harness to practice a full gait cycle. The primary goal of this intensive rehabilitation is to achieve the highest possible level of functional capability. This process is designed to maximize neuroplasticity and prevent secondary complications, while pushing the remaining intact nerves to their absolute functional limit. By combining physical manipulation, using targeted technology, and medical management, a patient can stabilize their internal systems and regain the functional mobility necessary for daily life.